Many times pediatricians get an hysterical phone call. Somebody in the practice had sex, and whatever they had for a barrier, it didn't work. It broke open. There was a hole in it. Who knows what? What should you tell them?
Well, one of the new things that are available to us as pediatricians is something called emergency contraception. Emergency contraception actually has been around for many, many years, and we've used it in people who've been raped. We now know that that if you have unplanned sex and it was unprotected, that is, nobody used the condom, or the condom broke or slipped off, that we can use this form of emergency contraception, the trade name is called Plan B, to keep adolescent girls from getting pregnant. Within 5 days after unprotected intercourse, either the condom broke or the condom wasn't used, using emergency contraception, Plan B, is safe and will result in not getting pregnant. It is not an abortion pill. It doesn't cause an abortion, so that if you're pregnant and you take it, nothing will happen. It doesn't harm the fetus in any way and will not result in an abortion. But within the first 5 days after unprotected sex, emergency contraception is appropriate, and it's important for teenagers and their parents to know that by calling their pediatrician and getting that prescription for emergency contraception, they can prevent a pregnancy or an abortion.
If it was a rape, or you not know the person who had sex with them, is there a risk of HIV?
There's not only the risk of HIV, there's the risk of syphilis, there's the risk of gonorrhea, there's the risk of chlamydia, there's a risk of any sexually transmitted disease. So that when we see girls who have been raped, we screen them and we treat them as if they have been exposed. We want to make sure that an adolescent or a young woman who has already gone through the traumatic experience of being raped, which certainly is sad, doesn't additionally have to develop sexually transmitted disease. So we screen them and we treat them. We also give them emergency contraception to make sure that they do not that rape does not result in an unwanted pregnancy.
So in other words, you could actually give them an HIV drug protocol for a certain period of time and reduce the risk dramatically of it happening. Is that correct?
That's correct. Not only will we do an HIV test at the time that the adolescent comes in saying that she has been raped or he has been raped, we will also provide them, not with a prescription, but we'll actually provide the anti-HIV medications for them to take for a period of weeks, so that if they have been exposed, it lessens the likelihood that they will become HIV positive.